I'll call the meeting to order.
Huh?
Call the roll.
I got my hair cut.
She's here.
Thank you.
Surgeon. Here. Steve. Here. Dr. Westover, she's, on this. All right, we got, 4, 5, 6, 7, 8 out of 11. 34. Any public comment?
Anybody?
Anybody want to
Sign
sign
up
for
for
public
public
comment?
comment? Okay. Approval of minutes of February 14th,
Ronnie, we do have a couple.
Oh, we do.
Yeah.
2009.
Do I need to sign? Yes.
Excuse me, I'm didn't get ahead of myself here.
No, I'm shooting right over your head.
You'll go, no taking pictures.
Your jacket, Ron. I'm trying to figure out where you got it.
I don't want to be on the
Oh, he saw it, did it, man?
You want to speak now?
Yeah, that's all right. I mean, I thought you wanted
Would you
to.
mind coming over here so I can hear you?
I'll do that.
And there are people on the phone.
My name is Valerie Rowlett, and I live in Jonesville, Virginia, and most of you all have been here before. And I am sure that you all are tired of being on this board and listening to people like me that second guess your choices, and I'm sure that you've just been made miserable by the virtue of being on the hospital authority and having to suffer through this ordeal. But the flip side of that is being a citizen who has attended meetings, read, studied, asked questions, watched the news, and still has no answers. Public expression allows governing bodies to give the appearance, while in reality sends the unspoken message to citizens that they don't deserve an answer, or that we are too stupid to know the answer, or that boards really don't care if we have the answer, or that Lee County has to deal and take any deal that's offered because it has no other choices. That last assumption is the most dangerous of all because it sets us up for failure. We all remember America. They were the only ones. And the people that live in Lee County do have questions. They want to know, how can Lee County purchase the hospital building from Wellmont, allow AmeriCorps to borrow money for the building as collateral, and then borrow $2.1 million from Valley to pay off the AmeriCorps debt? How can the Board of Supervisors and the Hospital Authority tell us that was not a loan? Interest and amount borrowed and a building as collateral is a loan. Just because it might be paid back in profits, it still costs the people of Lee County. I don't understand why we have such a hard time taking care of ourselves and just stating the facts. To add to that line of thinking, Lee County allowed AmeriCorps to come first and be able to borrow money to improve the building. I understand that. The building needed work, but to have placed us in the position was foolish and has cost us. After hearing from the Board of Supervisors and the Hospital Authority that all the money was put to good use, I then see a valid spokesperson on TV reporting that they are going to have to spend an additional $250,000 on the roof. You cannot have it both ways. Either the money was spent well or it was not. You all were the ones who approved it and supposedly were overseeing spending. So what gives? Unfortunately, and I know that I'm going to lose friends for saying this, you all owe the citizens of Lee County some answers. We deserve to know. As a citizen, I am in business with you and will reap the consequences of your votes, good or bad. Mr. Mitchell, you and our own delegate Terry Kilgore worked with the Southwestern Virginia Hospital Authority to get valid CEO agreement approved. And at the end of this journey, the hospital authority is working with Valid. How can our esteemed delegate, Terry Kilgore, not worry about the appearance of conflict of interest when he took a $5,500 contribution from Alan Levine, the CEO of Valid? Optics, ladies and gentlemen. On June the 19th, 2019, an article appeared in the Kingsport Times News. Valid cautiously optimistic about Lee County opening in 2020. The opening date has been a moving target, and no one can give us any idea. That and the fact that Valid would only be required to keep the facility open for 5 years, and how are we going to pay back that $2.1 million with interest is a little suspect to me. Valid will be a monopoly that's 14,000 square miles and can completely merge the assets of Wellmont and Mountain States on July 31st. The Federal Trade Commission did not approve this merger. Valid circumvented the FTC by going and getting the Tennessee and Virginia legislatures to vote for it. That's a fact. I watched the recent FTC workshop and heard the dissenting voices that said that this is not a good idea. Valid has a lot to prove, and painting a landing zone, sticking up a sign and saying we're going to open, at this point, doesn't sound a whole lot different to me than AmeriCorps. Finally, the authority has spent hours in executive session. Literally, you have met, taken roll call, and gone immediately into session, only to come back out and adjourn. For those of us interested enough to attend these meetings, your dismissal of our efforts to stay updated and knowledgeable is hurtful. Executive session is not intended to be used as a way around taking minutes that can be requested by FOIA. The optics for this are not good, and the citizens need to be on the same page with you. We are not your enemy.
Thank you.
Do you want that?
Valid.
Do you want that with the minutes?
Beg your pardon?
Do you want that with the minutes?
Sure.
Because I tried to take notes and then I.
Sure. Yeah.
Do you have a copy of it? Can I make a copy of it?
I was going to get it to you in a second. I've got some other questions down here, but there you go.
Any other public comment? Approval of minutes of February 14th of 2019 and April 22nd, 2019 meeting. Are there any questions about the minutes of those two meetings? Any discussion? If not, is there a motion to approve them? A second? All in favor, say aye. Opposed, like sign. Motion carried. Any old business? So we go to old business, update from special committee, Mr. Elliott and Ms. Post. Y'all both want to speak at the same time?
Yes.
Well, I think the update is we just continue to have our weekly conference call with the delegation for ballot. And we also have generally on the phone, we have representatives from Congressman Griffith's office, and Senator Warner's office, and occasionally Senator Kane's office. Representative from BDH remains very supportive of the effort, and I think at times a little bit baffled as well. So they're the only, probably one of the first critical access hospital applications some of them have ever seen. So they're getting on board as well. But other than that, I think Marty has an update. Ms. Diana has anything else? Oh, we did, there was a delegation that went to D.C. recently to meet with Senator Warner and Senator Kane and Congressman Griffith Larry went, Gil went, and Higgins. And Bobby was there, and that's all that they got.
Any questions? Lonnie, give us a report from that.
Absolutely. In fact, it was exactly, I'm having to stare at this because it now has got this silly thing that has voice or face recognition on it. Glasses. There. He doesn't recognize me as being me. Okay, so what I'm going to show you is actually what I'm using right now in all of the different meetings that I've had. I did Lions Club. Oops. Speak up even louder. Lions Club meeting. I've done Board of Supervisors, Town Council. I'm going to do Pennington Partners here shortly. And if there's any other groups that they would like for me to end up presenting to, I'd be more than happy to. These slides I show you are going to update as things move forward on the project. My name is Lonnie McLaurin. I was part-time given this responsibility in March, and now it's pretty much full-time as of June 1st, with the goal of getting our critical access hospital open here in Lee County. There. Okay, so what we're going to do real quickly, run through a few slides that we've got here. Obviously, reopen Lee County Hospital is the #1 thing that we have up here. Also to enhance some essential services, and those essential services are outlined in condition 27 of the cooperative agreement. That's a public document. It's on the internet. You can pull it up with VDH to see what that is, but I've actually got it on here as well to show you. But there's a lot of steps that we're going to end up taking to get there, and we're committed to doing it the right way. We've got a lot of experience at Valley in terms of supporting rural hospitals. These are 3 hospitals that we opened. The most recent one was Unicoi Hospital down in Irwin. The other 2 you're familiar with are both Virginia hospitals. But most importantly is our experience that we've had with critical access hospitals. We've got 3 that we're operating right now, one in Clintonwood, Virginia, and the other 2 in Tennessee. You kind of see the size on the different ones that are there. On the one that's in Hancock County, actually, we've gotten some pretty significant awards on that hospital and recognized nationally for their service. So we have a lot that we can end up building on and using as prior experience. So let me tell you what a critical access hospital is. This is the definition that comes right off of CMS. It is a designation given to rural hospitals by Medicare. It was formed in the 80s and 90s because we had a lot of the small hospitals in rural America that were closing because of financial troubles. So the whole purpose of the critical access hospital is to reduce that financial vulnerability. And so you can see that the designation that they have in order to be able to get this category is to have 25 or fewer acute care inpatient beds, be more than a 35-minute or mile drive from another hospital, or in the case of Lee County, be more than 15-mile drive in an area with mountainous terrain. So we are in the process of getting an update from the Virginia Department of Health as well as Kentucky Department of Health that we do have mountainous terrain that sometimes will cause us to end up having a longer drive, which will allow us to get that critical access hospital designation. The average length of stay on a critical access hospital patient is 96 hours. And by that, I'm saying there's some that will stay longer, and some that will stay shorter. It all depends on the condition of the patient. If it is something that needs to be transferred, then once it's stabilized, then they will move it to either a hospital in Pikeville or Norton or wherever the patient would want to be there. And then most importantly is to provide 24/7 emergency care services. We feel that Lee County Community Hospital will meet that CH designation, and that's what Senator Warner, Senator Griffith, Congressman, still learning names, Congressman Griffith is going to do, and then of course, yeah. And then, of course, at the state level, Delegates Kilgore and Pillion are very involved in that as well. So Virginia Cooperative Agreement 27, and that's what I mentioned, this is what's driving us as we're moving towards developing the the critical access hospital. And it states that if they, and I'm going to skip down to the center of that, but the beginning of it says that if a hospital is opened in Lee County and subsequently fails or ceases to operate, that Ballard will provide essential services for Lee County. The most important piece of this is the center of that says that an acute care hospital is not open and operational under a partnership with the hospital authority by December 31st, 2018, that Ballard will provide essential services in Lee County until such time as the hospital is open and fully functional. So that's directly out of the condition. Here's where we are right now. Obviously, January of 2018, we ended up getting the cooperative agreement signed. That's what allowed Ballard to be created. There's a similar document called COPA that is for Tennessee, and this committed us to opening that hospital should the owner be unsuccessful. January 1, obviously the hospital authority acquired the hospital back from AmeriCorps. Mid-February, we signed the letter of intent, and we have been in process of working out the details of the definitive agreement, which we hope will be acted on in this next month in August by the hospital authority. In the interim, there were some things that needed to get taken care of at the hospital that couldn't wait for the definitive agreement, and so last month the hospital authority met in developing a letter of authorization for us so that we can go ahead and act on behalf of the authority in this period of time. Some of the work that we've done so far is we've picked up and paid all utilities at the hospital since the letter of intent was signed. We've had to do some repairs over at the hospital to protect it. The EMS agencies, when we've met with them now 3 times, and one of the first things that they said that they would like for us to try and tackle was to create a safe environment for helicopters to be able to land. The helipad was, the lighting was no longer working, and it was really an unsafe situation for the air ambulances to try and land. So we've at least got that now painted. We've ordered the equipment for it, and that'll be installed during August. We've got a total of 8 different work groups that are meeting. Quite frankly, some of these are meeting on every 2-week basis. They cover every aspect of getting the critical access hospital open. I point out the 2 that are under services. One of them is EMS Resource Support Project team that I'm heading up and working with all the Lee County agents, EMS agencies on some priority items there to try and enhance their capabilities. Within the last month, one of the things that they said they needed were some of their EMTs needed some assistance in terms of training. And so we were able to secure some money that we're going to be offering to EMTs that would like to get advanced training. And that'll start, I think, there's one course that starts in October that's provided by Southwest EMS Agency, and so we're going to be doing that with them. And then the Urgent Care Center project team, which is really meeting now weekly. The renovations are well underway over in the medical office building. It's going to house the Urgent Care Center. The recruitment on the physicians has already started. By the end of August, by the end of August, they will have completed all the construction-related items that we needed to do. We will post the positions in the latter part of August that we'll need to hire in, and we're going to be wanting to hire local, obviously. We've got some people that are working here, that live here in Picayune Gap and in Lee County that are having to travel to work elsewhere. We're looking forward to having them to be able to stay home. Radiology equipment will have x-ray capabilities. That radiology equipment will be installed at the end of August. No, the end of September, not the end of August. And we anticipate opening the first part of October. We'll be doing a lot of promotion of that because the physicians that are there, when you hear urgent care, you just think, well, that's just a doc in the box. The ER physicians that we're bringing in are 2 trained ER physicians that are going to be capable when the critical access hospital opens. We'll close the urgent care. They'll move right over to the emergency room. The staff will move right over to the emergency room, and people will already know the folks that are providing care when they move into the next phase. The construction facility resource planning team is also working. We've got schematics that we've got drawn up that will be part of the critical access hospital. I'll tell you a little bit about that in a second. Some of the activities we have, we already mentioned, Howard mentioned the weekly meetings with the members to monitor progress, so I get a weekly report of updates on that. We've got monthly columns starting in the Powell Valley News to try and bring people up to date with what's going on and what a critical. I think the next one that's coming out is what is a critical access hospital. The first one was what are some of the major elements of the critical access hospital application. And that is the community health needs assessment. And we have a team on that. I'll show you that in a second. Meeting with civic clubs and, like I say, the community health needs assessment. The committee membership of the community health, our community advisory committee are all local, with the exception of a couple of folks from Ballard Health, including myself. These are people that you know, you recognize, you do business with, and their input has been very valuable to us in being able to establish the priorities. They've already had 2 meetings. The last one was last Friday. There'll be a 3rd meeting that occurs August 9th, and that will be for us to establish what those health priorities are. And that then goes into the critical access hospital application. A lot of you haven't seen the interior of the hospital in quite some time, and in fact, I've actually took a number of tours of people just to kind of give them an idea of what the inside really does look like. These are just some series of pictures that we took of what we walked into when we came in. And as you can see, there's work in progress, but there is much yet to be done. That right there is just radiology, the 2 far right pictures there. We do have some issues with the roof. The roof over the emergency department is leaking. The composition of that roof is such that we cannot patch it, because that was the first thing I wanted to try and do, was see if we could do that. It's just the type of roof that was put on. It's a rubber roof. It will have to be completely removed and replaced. These are qualified contractors that have already told us that there's no other option on that. So we have capital equipment or capital that is being approved to be able to go ahead and move forward on that. That's the roof that is over the emergency department. If you know how that hospital is built, that's the 1st floor, so it's not anything above that. The roof that is above the 4th floor will eventually have to be replaced. That wasn't done recently, and that'll have to be tackled a little bit later. But this is number 1 for me, because obviously we don't want to have any more damage to the emergency department. So here are some of the tasks that we've got before us. I already mentioned architectural and construction drawings, community health needs assessment, We've already completed the physician demand analysis, and there's a financial impact feasibility that's also required for us to submit to the federal government. By the way, this application will first go to Virginia Department of Health. That's a requirement. And then from there, it then goes to the Fed. And that's where our federal elected officials have already offered their assistance in helping to grease the skid, so to speak, to get the approval as quickly as we can so we don't lose any time. We also have these requirements, and this is a requirement for any hospital that you go through. You've got all these licenses that you've got to do, Medicare, Medicaid certifications that have to take place. And then on the information technology side, which is the computer system, when Ballard was formed, we had two systems with two completely different information systems. They don't talk to each other. They didn't need to talk to each other because we were competing with each other. So we have settled in on a single platform that we're going to use for all of the hospitals in Ballard, and that's Epic. Epic was the system that Wellmont had been using. It's the newer of the two systems. And so we are in process right now of getting that done. The first order of business was bringing up all of our physician offices, which allow them to communicate with the hospitals. That has already been scheduled, and we'll be having that. I believe that is in June of next year, so it won't take that long. All hospitals will come online in October, and Lee County Hospital will come on at exactly the same time as Johnson City, Unicoi, any of the Mountain States facilities. Everybody comes on at the same time. It's a lot of work because you're having to literally build a platform for all of these different facilities. That's not the main reason why it's going to take as long as it is, and that is, the ICU, which if you have been in that hospital in Lee County Hospital, you know that the ICU is located behind the emergency department. The ICU is going to be the area where we're going to create 10 inpatient acute beds. You want them as close to the emergency room as you can so that the physician that's there in the ER can also provide care to your patients. We do this in all of our critical access hospitals. It's the most efficient way to do it. Your nurses stay busy that way in both sides. And if you have an emergency, you're not having to jump on an elevator and go up 2 floors, 3 floors. You've got all of your systems and services right there. So for the ICU area, we're going to have to literally take that completely wall to wall, rebuild that, because the ICU rooms do not meet the requirements. They don't, for example, they don't have bathrooms. And the requirements on an inpatient acute bed is you have to have a bathroom. It has to be handicap accessible. You have to meet all the current requirements. So this will be the thing that's going to take the time. We have the schematics drawn, and those go in with the critical access hospital application. Once that application is approved, then we can move to construction drawings. You don't do construction drawings and spend all that money, and then they say, no, you got to change this or that. So once we get the approval, we do the construction drawings, then you have to take bids, then you do your construction. So if anybody's done any building, you know that just takes that kind of time. It will be done right, though. These are the essential services that are listed in Condition 27 that we'll be assuring that we have available: emergency room stabilization, emergency obstetrical care, the outpatient diagnostics, that's both lab and x-ray. We are doing on the rotating clinic or telemedicine access. We're currently rolling out telehealth to all of the school nurses in Lee County. That comes online in October. And then we will have access also for telemedicine. That's for specialists when we open the urgent care center, so there'll be support there. The helicopter, of course, we've got that available already. Mobile health services, we actually did our first screening option, which was mammography a couple of weeks ago. We'll have a bunch more of those as we get those scheduled and they are available. Primary care services, we actually are talking with Stone Mountain in terms of any additional assistance we can provide them in recruiting. So we're, again, not trying to compete, but rather working with our partners. There is a new physician that will be joining Dr. Maloney's practice in another month. She is finishing her family practice residency right now, wants a package. She wants to come here and work full time. And we're also working on, I think, pediatrics to try to provide pediatrics. So physical therapy rehab, I can tell you, I've already met with Moving Forward. We've got an excellent rehab facility here in the area. And again, we're not going to duplicate. We want to end up working with them. And once the critical access hospital is open, we want to end up contracting with them for those kinds of services. The behavioral medicine piece of it is one that we have an entire plan for the entire system. We recognize the significant issues we have in both Northeast Tennessee as well as Southwest Virginia related to opioid abuse. And so we do intend to have some services available for that as well. Like I said, we believe in a partnership, so I mean, these are people that I've already had some contact with, looking at options that we can end up assisting and supporting. Health and Rehab actually is going to provide us with our food services. We've already talked with them, and they're more than happy to end up working a contract service out for us there. Also with our EMS providers, and of course Lee County is kind of unique in the size of the county from one end to the other is such that we want to end up providing them support. The cardiac monitor upgrade is a future item. We recognize that we're going to be moving in Virginia, Southwest Virginia, from 3G to 4G. Those ambulances will have to have a patch until we can get the brand new cardiac monitors in. The new cardiac monitors haven't even been released by FDA yet. Sullivan County is going to end up getting those. Washington County, pretty much all the locations that previously had those monitors, and I've shared that with the EMS agencies. And also with local education. Training programs, the LPN, nursing assistant, and EMT training programs over at the Career Tech Center. I talked to Brian Austin about that. He's very interested in a close working relationship for the clinical training, and I believe that the school board has even met about possibly having those services housed over at the hospital, which would be great if we could end up doing that. That's still early on. And then, obviously, with telehealth, I've already mentioned sports medicine, and for the smaller kids, the morning mile. In fact, I'll be August the 2nd, I believe, Flatwoods Elementary is going to have their parent orientation. We're going to be there to end up sharing with them the telehealth option for the school nurses. That's also going to be available, by the way, for the staff, not just for the students. So, where we go from here, our next steps, complete that definitive agreement, get that community health needs assessment completed, submit the application by late August, open the urgent care center in early October. Construction, we're targeting fall of 2020 to get the hospital finally open. And we're going to continue to provide updates to you and the community as I move forward. I'm spending as much time up here as I am at home right now. My wife's sitting there saying, I thought I was going to see more of you after June 1st because I was responsible for 8 hospitals in Northeast Tennessee.
Seasonal health section. Can you speak more about what you're going to do?
Yeah, I didn't mean to
Yeah. So
slip
that
over
just seems
it.
to be the only thing.
Right now, what we reckon, and it came up, I was at the Northern Board meeting earlier today, and the same thing came up, and that is, what are we going to do? Are we going to end up, what kind of services are we going to have? Are we going to have psychiatry available? Are we going to have some services such as inpatient rehab available as well? Eric Deaton's online. He kind of related that to the board up there as well. We recognize that is a significant need, and we will have services available. They're currently being formulated in terms of what they are. And the community health needs assessment was one of the critical elements to see how far that was up on the priority level, and it's pretty darn high.
think, don't
Yeah.
we? We hope so.
Yes, ma'am.
I may have missed this, but there was that list of community advisory members, very impressive. And I may have missed it, but I don't believe I saw any minority representation on that list. And I can't speak for the whole minority community, but I think it's important that
Not intentional, and I would ask this, if there is a group, an organization, we're doing focus groups right now, and now's the time for us to be able to schedule that, so if I can work with you afterward, I'd love to end up doing that.
And I say that because sometimes there are issues, health issues, that are.
I think one of the focus group is on there. We have added, the town council at Pennington was one of our focus groups. And you're on that, right, Chris? Yeah, that was one.
You know, I don't say that for me, but I say that because there are some health issues that are, sort of, addressed, that minorities have, that
We can even do, if it's a church group, I mean, if you have a group of people that we can end up, I can help get that arranged, that'll go into the whole series of priorities, absolutely. We're trying to identify as many of those key areas as we can. We met EMS, for example, all the EMS agencies met, we have them as a focus group. They see things that nobody else sees. In the homes, wherever they are, we got some really good feedback from them as well. So if we can, I'd like to. Yes, ma'am.
First, I want to thank you, those of us that use Moving Forward. I love hearing that you've kept local people and not compete with a local, exciting, good business. I'm interested in the hiring. I know Patton Speaks and I were real concerned when we closed and everybody lost their jobs and they ended up going to other hospitals. Could you tell us more about, I guess you're going to have very limited doctors because you're going to have just an ER doctor.
We're gonna, they actually, the group that we are contracting with for emergency, sorry. Ronnie, sorry. The group that we're contracting with is actually the same group that provides emergency physicians to Norton Community Hospital, Dickinson Hospital, Indian Path, Sycamore Shoals, several hospitals. They've already told me they've identified 2 physicians that are interested and feel pretty confident that they can get those by the end of September. So,
And how about the other, tell us some more about how you process the
Sure.
job applications and local people getting jobs. What's the deadline for that?
well, for the urgent care center, they should be getting started pretty quickly to be able to do so. I've already said what I really would like. What I would really like and what I want is the local, people that are qualified, that are local, get first opportunity. You wouldn't believe how many people have come up to me that I know that work at Indian Path and some other places. As soon as something comes up and let me know. I have a pharmacist that works at Kroger in Kingsport. She came up to me and said, I want to work some shifts. So the thing is, I don't think we're going to have that much trouble staffing. I really don't. I think there are a lot of people that live just in the area that are having to travel elsewhere to get work that we will be able to keep right here. Yes.
I had a question about your helicopter medevac services. Is that going to be contracted out, or who are the providers for that?
Yeah, we had 2 separate, when we were competing, had 2 different companies. And so they made a selection of one, it's Medtrans. So that'll be the same one that'll be used for all of them. That's about all I know about it because I'm not an expert in that area, but it'll be a single one that'll provide the service for all of it. And the state police for Virginia, they're continuing that relationship. That will not change.
So you'll have the public option and the private company option, the state police option and the private option.
Yep.
I have a question. I'm Woodrow Grizzle. I'm the publisher of the Lee Daily Register. Yeah, and I've not had a lot of success getting my requests for interviews with ballot officials acknowledged. And I would just ask that you guys, include me on what's going on, because the Powell Valley News is wonderful, but we have two very different audiences. That's how two businesses can exist. I mean, in a tiny county like this, you normally wouldn't need two newspapers, but we have a different audience because we're online and the Powell Valley isn't. So I would just ask that you could increase that. If you would, it'd be great.
I'll give you my card at the end.
Okay.
And, I'm about the most transparent person that you know. I am what I am. I grew up in a small town in Louisiana. I hated living in Dallas. It was the worst. So,
Okay.
when people ask me where I live right now, I'm on the other side of Wadlow Gap.
Yeah. Thank you.
All right, thank you, Monty. All right, well, this time we need a executive session.
So, Mr. Chairman,
I would
yesterday,
hate to be disappointed.
We held out as long as they could.
we received the first drafts of the agreements with Val, and then we need to go into executive session so I can get some. My pleasure.